Dr. Jackie's lack of compassion and empathy is going to be her inevitable downfall. And we are seeing that happen right now. Let's talk about it. Y'all already know what time it is. I got the black V-neck on.
So we finna get into some things, but I do want to let you all know that I recorded this video before Dr. Jackie released her apology. So I am going in because I expected Dr. Jackie to offer a better apology from the very beginning. And I feel like this is the reason why she's dealing with even more backlash. So I just want to give a warning because it did shake me up to look at Dr. Jackie and her, her tone. And you can just tell that there is some level of sincerity, and we've never seen Dr. Jackie like this at all. But I do think that Dr. Jackie needs to take this as a learning moment. I do have some concerns about the apology, but I'll get into that later.
What's going on, you all? I told y'all that Dr. Jackie was going to come with this energy. I told y'all that Dr. Jackie was going to tell y'all that video was 3 years old. Y'all taking it out of context, da-da-da-da. I am not surprised. And girl, Dr. Jackie, I hope you are listening. I hope the cast of Married to Medicine is listening. I hope Heavenly is listening too, because you blocked me on Twitter after I gathered your ass. But I'm going to be completely honest. And hopefully my pink and green shirt will come and make Dr. Jackie pay attention. Dr. Jackie is getting ate up on Twitter, TikTok, Instagram. Girl, even the Instagram blogs is picking up and posting things because Dr. Jackie's apology lit a fire under a lot of folks. Like, Dr. Jackie, the more you keep doing this, the more you keep showing lack of compassion and empathy, the tougher it's going to get for you. Your ass is not old enough to get gathered. Dr. Jackie is doing that honorary shit that I do not like when it comes to older folks. Like, they just refuse to bend or twist. They just, I'm not changing. You're gonna have to change because the folks is chewing your tail up on social media. So Dr. Jackie came with this half-ass apology, and the girls is lighting up. This is what she had to say. Recently, a clip from a nearly 2-hour video was taken out of context to make it appear that I somehow take lightly what I have advocated for concerning the devastating problem facing the Black maternal health crisis. Now, Dr. Jackie is talking about this interview that she did, or discussion, live question with Dr. Heavenly 3 years ago, 2020, around the time of the COVID or whatever. She's still here because she's chewing the girls up right now. But in this 2-hour discussion, people were asking questions, Black women were asking questions, and one Black woman asked a question about the Black mortality issue when it comes to Black women. Like, why are Black women passing away while giving birth? Why are their children passing away, their infants, their children and stuff after birth or during the surgeries or whatever? What is going on? And Dr. Jackie said that she doesn't know the answer. Matter of fact, I'm gonna play the clip.
Black females, why more mortality rate with Black females?
Now, I wish we knew the answer, and I will not allow myself to say it is health disparity only.
Dr. Jackie says we're taking stuff out of context, but in her own mouth, she says that she doesn't know the answer to it. What data did Dr. Jackie show us? Like, this is a doctor who knows, like, she does a lot of reading, she is understanding, she retains knowledge. Where did Dr. Jackie say that she got this information from? What evidence has she seen that supports this claim other than her own anecdotal evidence? And you should know that biases like anti-Blackness jumps out. And that's exactly what's going on. You are honing in on saying Black women, want to get off of work and, whatever. Sometimes they exaggerate their claims. But even in discussions and data, Black women are not even the ones receiving the bulk of pain medication when they are, quote unquote, making all of these complaints. So Black women are less likely than their other counterparts to receive pain medication.
Studies have shown that Black patients are significantly less likely to receive pain treatment than other patients. And Black pregnant patients don't get access to the same interventions. So it seems like providers are not hearing us in times that we need them to hear us the most.
Like, none of this surprises me. None of this surprises me because biases jump out, and this is some of the stuff that I talk about with other physicians when it comes to treating patients, like talking to doctors and stuff about treating patients with HIV and AIDS, because health disparities play a huge problem because a lot of times doctors do not want to advocate for specific demographics, black folks. They do not. They already have this bias of folks doing the most or whatever, like it jumps immediately out. There are a lot of things that are affecting black women and the care that they're receiving, and I guarantee you them quote unquote complaining is at the very bottom, that it's insignificant. It's not even enough. When we're seeing, hey, like your income affects this, and even when you are making more income, you're still at risk. And Dr. Jackie is one of those folks, she believes in health and all the other stuff. Like, y'all keep telling black folks to, oh, y'all need to eat healthy, y'all need to do this and that. But a lot of black folks live in food deserts. Black folks are working way harder than their white counterparts. Like, they are working jobs that require a lot of labor. They're in areas where environmental racism is impacting their health. The hospitals and things are not making money. They are not in business. They are not in business to make sure patients are okay. They're not in business to heal the sick. That's why you see it everywhere. They are in business to make money. Point blank period. Point blank period. And Dr. Jackie can say all this stuff until she's blue in the face, but it absolutely means nothing. Like, you were sitting here talking about, you know, Medicaid with Kamala Harris, and then now you're being called out online for the folks saying that you don't even take Medicaid and that you really don't even like taking insurance. You really like folks paying you with cash. Now, some folks online are saying, well, there's nothing wrong with that, A lot of folks do that. Yeah, it is something wrong with that. It is something wrong for a doctor to get and advocate for Medicaid for all and all this other stuff when you're talking to a vice president who does not even support universal health care. That's one. And you're sitting here advocating for something that you don't even participate in. Yes, Dr. Jackie might have worked at other hospitals and stuff and but her place that she takes her patients does not take Medicaid, from what the girls are saying. And Dr. Jackie, you and this apology has put a fire even more on folks to talk about their experiences with you. Not only you got Buffy from Married to Medicine coming chewing you up in TikToks and stuff and going viral, you have other patients who have said they have been with you and that you gave them bad advice, or you did not show up, or you did not give them good service, or you wasn't a good doctor to them. Now, the first conversation wasn't about you being a bad doctor. It was about the 2-minute clip that hurt black women's feelings. Black women were in the comments saying, I like Dr. Jackie, but this isn't it. This is because black women are going to doctors and physicians and hospitals and emergency rooms, and they are hearing and experiencing this thing that you are saying out your mouth, and it hurts more because they look up to you because you are a black female doctor, that you are a black female OBGYN. So to hear that, wow, even a black female doctor is speaking the same way as a white doctor would talk to me. And that stings when you are thinking that like diversity is going to save you, which it's not. Because if these folks are not caring and advocating for black folks and have the same politic, it doesn't matter what position of power they are in. They are still not gonna look out for us. That's why the skin tone, the skin color ain't enough for me. I don't need no representation. I need to see how you think and how you move and how you treat black folks. That's what I'm concerned with. Because the black, you being black ain't just enough for me anymore. I've been let that go for a minute. But you have black women complaining and talking about, you know, them being hurt by Dr. Jackie's claims. And in this apology, Dr. Jackie doesn't say at all, hey, you know what? I said this 3 years ago, and I can see how it is hurting black women 3 years later. What I said was ignorant, and I have learned from this, and I am continuing to learn from this, and this is the work that I am committed to doing to fix this problem. None of this shit you said. None of this shit you saying. As a physician, I educate, you go back into, I tell my folks to advocate for themselves, Patients are advocating for themselves. Black female patients are advocating for themselves, but you're not listening, which is going back to the 2-minute clip, because you're saying that they're complaining. So if you are saying that you don't know what is causing the issues with black maternal, like pregnancies with black women, like why is it so low? You saying you don't know what the issue is, but immediately jump into this, and black women are saying you're not listening. Dr. Jackie, It's not looking good for you, good sis. It's not looking good for you. And you say, I don't want to put it completely on health disparities. That is the dumbest shit I have ever heard in my life. No shade. And it's even dumber coming from somebody who's intelligent as Dr. Jackie. I'm not going to say it's health disparities. When you have a history of fat phobia, I'm not really surprised that you said that. And going back, Dr. Jackie, your lack of compassion is going to be your inevitable end. I'm telling you now, because you don't seem to get it. Even when it came to Buffy years ago and how you brung up her fertility issues to the public, and which I still to this day cannot believe that happened. I want to believe in my mind that this was something that was just made up. You took someone else's pain and you tried to prop yourself up and talk about it. You don't get to tell somebody how they need to go and advocate. Buffy ain't got to speak a day in her life about her issues. She don't have to do that. As folks who are HIV positive and living with AIDS, they don't have to be an advocate for any of this shit. They ain't got to do none of this work. I choose to speak on it because I want to. But ain't nobody gonna make my ass talk about it because they feel like I need to. You don't get to tell me what to do with my experience. You don't get to do that. And that's what your ass did with Buffy. Now I'm getting pissed off because I can't imagine somebody telling me to come up and Justin, you know what, because you dealing with this. Bitch, I ain't asked to be speaking on this shit. And then when this woman asks you for an apology, I gave it to you, receive it. You ain't got to worry about me no more. Nasty ass. And I'd be the last person that want to ever call a black woman nasty or vile or any type of nasty spirit. But Dr. Jackie, girl, it is hard. Going back and watching this clip and how you talk to Buffy and how you are talking to black women now, you are being directly nasty to black women. That's what's pissing me off. Then you got Heavenly out here talking about something. Well, I know Dr. Jackie's heart. What the hell does her heart have to do with her brain and her emotions and how she's showing up for black women? The heart don't do shit but pump blood. I know you a dentist and you don't know much about this shit, but girl, come on now. Like, I really can't stand when folks say with shit like that, with her heart. What the heart don't do shit. The emotions are in our brain. Y'all over here saying some shit that don't even make sense. Makes sense when you talking. You knowing her heart, you being her best friend. Girl, Dr. Heavenly, no shade, girl, in full shade. You were the last one need to be talking Dr. Heavenly University. The most scamming shit I ever had. Like, girl, what the hell? Dr. Heavenly cannot teach your ass how to be a millionaire. It's not that easy. Anybody who's offering you a free webinar to get rich is scamming your ass because they're gonna wait till you get the webinar and sell you some more shit. We seeing that so much right now. Girl, you might as well go sit next to DJ Envy. Period. You need to go sit on trial with him. Then Simone and Toya and girl Phaedra said, I ain't doing nothing but reposting shit. You got all these folks band together because y'all trying y'all best to come and shield Dr. Jackie from this criticism, and I get it that y'all love her. Black girl power. But if your black girl power is coming in silencing other black women, then the power is useless. If you coming together to silence other black women, because Dr. Jackie deserves these lashings, no shade. I hate to see it. I'm not really enjoying it. I'm not one of the folks online that's like seeing Dr. Jackie get ate up, but I can't disagree with that saying. And had you came here with a better apology and said something that made sense, I would say, you know what, Dr. Jackie has offered. And I'm wondering, is it possible for my legal scholars and lawyers and attorneys, if Dr. Jackie would have held herself accountable, would it have opened her up to medical malpractice lawsuits and all that other stuff? Would have been used against her? Like, I'm curious of that. But it's like, Dr. Jackie, you are not perfect. Like Mariah said, she ain't Jesus. But this is an opportunity for you to listen to black women. And I apologize for getting upset and whatever in this video, because I am someone who does hear a lot of black female patients go in and have these experiences with doctors, and I know how it shows up. I know how healthcare works in the U.S. It is awful. It is awful. Even as a veteran, the care that I receive is not the best. Like, it is bad out here. And to just see a black female OBGYN like make these comments, even if there was, it doesn't matter if it was 20 years ago, you take accountability for stuff that you said and the fact that you don't get The fact that you are jumping immediately and saying, oh, this was 3 years ago, it does not matter. The words hurt now. Nobody's out to get your ass. As much as folks want to say, y'all know the internet jump on everybody. The internet is not out here to get folks like that. The internet is not out to get and eat people up. Y'all think that, but folks don't be getting ate up like this, because I guarantee you a year later, if Dr. Jackie survives this, she will move on. Like, I get ate up. This is coming from somebody who gets ate up a lot. But I take it all in stride, and I learn from it, and I grow from it, and I move on. But I don't think ultimately that there's a hell of folks out to get me. I do think that there are folks who have criticism, and when criticisms happen and other folks are being legit, folks do hop on it and talk about it. But, you know, if they are amplifying the voices of folks who already had an issue, because if we look at some of the reviews, Dr. Jackie and stuff have been getting complaints before this even happened. So it's not that everybody out to get you. Y'all have sounded like the folks, well, you know, my teacher don't like me. All of them don't like you, and we can get into the conversation because, yeah, there's hella teachers that are anti-black as hell and do enjoy failing black students and stuff. We can talk about that. But Dr. Jackie ain't trying to have a conversation about any of this shit. She just said, girl, how dare y'all? That's what it came off to me. Came out very insensitive and all the things, and I'm not here for it. But y'all tell me what y'all feel about it. Dr. Jackie and this half apology, girl, the girls is chewing her up. Merry Christmas. And the only thing that's saving Dr. Jackie right now, that is no new episode of Married to Medicine coming out, which means the ladies don't have no reason to go live and do the discussions, but it's going to be quite interesting when they come back in January, because everybody's talking about this. Like, you have big name media outlets talking about this now, and Dr. Jackie's apology didn't save it. Heavenly help us. That's all I got. Let me know how you feel in the comments. Talk to y'all later. Bye.